Over the years, we've certainly seen that nicotine, tobacco have really been a large issue for the women that we serve here. And we've been lucky that we have Ruby, who is a health educator, and so we have someone that can just focus on the health and wellness of the women that we work with.
So the goal with applying for this WiNTiP grant was specifically to try and increase our numbers of people who were calling the quit line and enrolling in First Breath, in addition to trying to foster a new social environment here at the treatment center. We found that what I found as the health educator in my initial health intake questionnaire was that women were reporting increased tobacco use as a result of the break time social environment being smoking.
Ruby actually was the one who told me about the quit line, and when I found out I was pregnant, I was smoking about half a pack a day at least, and I know that my lungs aren't the greatest now. I've probably, due to blood clots, I've lost 30% of my capacity, and now having smoking on that is making it twice as bad. And then I don't want her to have to grow up with smoke in the house, and she needs to be healthy.
My 13-year-old definitely hates smoking, and she learns smoking from, school and stuff, so she does ask about, why do I smoke? Can I quit? So I try to explain to them it's just not that easy.
Without the grant, none of this existed. We didn't have the financial backing to incentivize the calls to the quit line. That was huge, and moving forward, it would be great to have funding to be able to say, I can give you $5 right now if you're ready to make that step today. And if you're not, could we talk about it again in a week?
I was like, yeah, there's a gift card involved. So I was like, yeah, I'll do it, but I never did it. And then everything was so hectic with that week, and I came to you and I was like, Ruby, let's call the quit line. So yeah, the incentive is what started it, but ultimately, I was like, it's time. So, but the incentive helped.
Well, that was also a good bonus with that, who doesn't need a little extra cash here and there?
In terms of the higher-ups and the administration here, we're all in support with doing anything we could to try and lose our reputation of being the place where pregnant ladies stand outside and smoke.
Well, the support, Ruby's really great at supporting it, she's on it. When we have our breaks, you want to do something different, come in here, we can do this, we can do that, play Wii in there for the Just Dance. I like that. And then there's the hotline, of course. They call and they always, see how you're doing, if there's anything you want to learn more about. The patch was a big thing. I'm also taking Wellbutrin. So it's like all those elements came together to help me quit smoking. Or to attempt to quit smoking this time. And I've reduced it to maybe I do a cigarette or two in a day, and that's it. And that's just amazing to me. From 10 to 2 cigarettes, and soon it's going to be none.
I think these grants have given us an opportunity to really focus in on it and make it a priority. Staff themselves are not consuming tobacco, nicotine, etc. So I think they're in a place where they know it's a healthy decision to make. So I think that's half the battle. They've all been to trainings about tobacco cessation and how important that is to recovery. So all of the staff, every step along the way, know that tobacco cessation is important for us to address. So our intake coordinator is talking to the women when they come in for intake about their tobacco use and diagnosing them if it's relevant. And then once they enter treatment, all the substance abuse counselors here are addressing it on their treatment plan as well.
There's a lot of women actually here that are positive about the situation that have also called the quit line. So, if you have the opportunity, just try it.
The little things that they tell you to do when they call. They have a little booklet they sent me in the mail, and it had little ways of getting around the habits that I formed from smoking. Like when I have my coffee in the morning, how do I get rid of that smoking that early in the morning? Well, they said, keep the hard habits first, get rid of the little ones. So it was like doing it in baby steps, and I like that. It wasn't just boom, quit now.
People don't give up all these other drugs to die from lung cancer, tobacco-related diseases. So making sure that we're offering the women everything that we can while they're here to really make sure that they leave here in a better place and more healthy. I don't know if you've ever heard the term initiative fatigue, where every week, every month, there's something new. There's something new and exciting and interesting that we want to work on. And then sometimes they tend to fade away after time, and you have to have folks like yourself and CTRI and WiNTiP who are saying, no, this is really important, and we're going to put our time and energy into it and support others in doing so. And I think without the support, it would not be happening for us.